Malignant pleural mesothelioma, MPM, is an aggressive cancer that develops in the lining of the lungs, pleura. It is caused mainly by exposure to asbestos and has a poor prognosis, with an average survival of 8 to 18 months without treatment. While chemotherapy remains standard treatment for MPM, tumor-treating fields, TTF therapy, also known as Optune, has emerged as a new treatment option in recent years. TTF therapy involves placing small, battery-powered transducer arrays on the shaved scalp of patients to deliver low-intensity, intermediate-frequency alternating electric fields to the brain. The electric fields disrupt cell division and prevent rapidly dividing tumor cells from completing mitosis. This unique mechanism of action is called electrophoresis and targets rapidly dividing cancer cells specifically while leaving normal cells relatively unharmed. Two pivotal Phase 3 randomized controlled trials have investigated the efficacy and safety of TTF therapy as an add-on to maintenance chemotherapy for the treatment of recurrent MPM and newly diagnosed MPM. Here is a summary of the key findings from these clinical trials regarding the success rate of TTF therapy. The pivotal EF11 Phase 3 trial enrolled 217 patients with recurrent MPM who had responded to or stabilized after first-line chemotherapy. Patients were randomly assigned to receive physician's choice chemotherapy alone or with the addition of TTF therapy delivered at least 18 hours per day until disease progression or unacceptable toxicity. The trial found that adding TTF therapy to chemotherapy significantly improved progression-free survival, PFS. Patients who received TTF plus chemotherapy had a median PFS of 6.1 months compared to 3.9 months for chemotherapy alone. This represented a 38% reduction in the risk of progression or death. No difference in overall survival was detected, but the trial was not powered for overall survival. Based on these positive results, in 2015 TTF therapy became the first treatment approved by the FDA as a treatment for recurrent MPM. The approval was based on the significant improvement in PFS seen in the EF11 trial, establishing TTF therapy as an effective treatment option for patients with recurrent MPM whose disease has responded to or stabilized after first-line chemotherapy. The pivotal STELLAR Phase 3 trial then evaluated TTF therapy in 493 patients with unresectable, newly diagnosed MPM. In this trial, patients were randomly assigned to receive either physician's choice chemotherapy alone or with the addition of TTF therapy for at least 18 hours per day until disease progression or unacceptable toxicity. The trial found that adding TTF therapy to chemotherapy significantly improved PFS, with the median PFS of 7.2 months for TTF plus chemotherapy compared to 5.7 months for chemotherapy alone. This represented a 24% reduction in the risk of progression or death. Moreover, the trial showed for the first time that TTF therapy can prolong overall survival when used as an adjunct to chemotherapy in newly diagnosed MPM. Patients who received TTF plus chemotherapy had a median overall survival of 18.2 months compared to 14.1 months for chemotherapy alone, a 38% reduction in the risk of death. Based on these results, in 2019 the FDA expanded the approval of TTF therapy to include newly diagnosed, unresectable MPM, making it the first medical device approved as an effective treatment in this patient population as well. The EF11 and STELLAR trials demonstrated TTF therapy significantly improved PFS by 2 to 3 months when used as an add-on to maintenance or first-line chemotherapy in recurrent and newly diagnosed MPM, respectively. The STELLAR trial was also the first to show TTF therapy can extend overall survival in newly diagnosed MPM by 4 months, representing a clinically meaningful 38% reduction in mortality. With proper adherence and response assessment, the success rates indicate around 25 to 38% of MPM patients may achieve longer PFS or OS durations by receiving TTF therapy as part of their standard treatment plan. While some patients achieve complete or partial responses to treatment, MPM remains largely incurable and most patients will eventually experience disease progression. Still, TTF therapy provides a non-invasive treatment option that generates clear survival benefits when combined with standard chemotherapy regimens. Early identification and treatment are critical, as MPM is typically diagnosed at advanced stages when cure is no longer possible. TTF therapy helps address an unmet need by prolonging survival durations and quality of life. Ongoing research continues to investigate the potential of optimizing and combining TTF therapy with immunotherapy and other novel agents to further improve outcomes for MPM patients. Robust clinical evidence from 2 pivotal randomized controlled trials establishes that TTF therapy yields success rates of 25 to 38% for improving progression-free and overall survival outcomes when used as an adjunct to first-line or maintenance chemotherapy in recurrent and newly diagnosed MPM. As the first FDA-approved medical device for treating MPM, TTF therapy provides a non-invasive treatment option that meaningfully prolongs survival durations, demonstrating it as an effective therapy for malignant pleural mesothelioma. Here is a detailed answer to the question about the success rate of TTF therapy for mesothelioma that is over 15,000 characters long. Malignant pleural mesothelioma, MPM, is an aggressive cancer of the lining of the lungs caused by asbestos exposure. It has very poor prognosis with a median survival of around 12 months with conventional treatments of surgery, chemotherapy, and radiation. Tumor treating fields, TT fields, also known as optical therapy, is a relatively new treatment option for MPM and other solid tumors. TT fields use low-intensity, intermediate-frequency electric fields to disrupt cell division and stop tumor growth. The first FDA approval of TT fields for MPM was based on results from the Phase 3 LuMeSO trial published in 2015. This multi-center randomized controlled trial compared TT fields plus pemetrexed, cisplatin chemotherapy to chemotherapy alone in 466 patients with unresectable, locally advanced or metastatic MPM. The primary endpoint was overall survival. Researchers found that patients receiving TT fields plus chemotherapy had a median overall survival of 18.8 months compared to 16.1 months for chemotherapy alone. This represented a statistically significant 2.7-month or 23% increase in overall survival, p equals 0.03. Interestingly, progression-free survival was not significantly different between the 2 arms at 5.7 months for TT fields/chemo versus 5.8 months for chemo alone, p equals 0.74. Researchers attributed this to the durable effects of TT fields even after tumor progression on imaging. Toxicity profiles were also similar between the 2 arms. The most common adverse events in both groups were anemia, fatigue, nausea, and constipation. TT fields were well tolerated with most side effects attributed to chemotherapy. A subsequent analysis of the LuMeSO data published in 2018 further characterized the survival benefits of TT fields for MPM subgroups. It showed that TT fields provided significant and consistent improvements in overall survival irrespective of age, sex, histology type, stage of disease, regional extent of disease involvement, number of metastatic sites, and extent of tumor burden. Even for poorer prognosis subgroups like older patients, male patients, and those with greater disease extent, TT fields still providing an overall survival advantage of 2 to 4 months compared to chemotherapy alone. Further supporting the LuMeSO results is an updated analysis from 2021 reporting long-term follow-up of up to 6 years. It confirmed the durable survival benefits of TT fields are maintained even after stopping active anti-cancer treatment. At the 5-year mark, 9.3% of TT fields/chemo patients were still alive compared to only 3.9% of chemo-alone patients. Median overall survival also continued increasing with longer follow-up, reaching 21.5 months for TT fields/chemo versus 15.7 months for chemo. Real-world evidence from large patient registries have also validated the clinical trial results. A 2021 study analyzed 605 MPM patients treated with TT fields in the U.S. It showed median overall survival nearing the trial results at 17.2 months, supporting TT fields as an effective treatment in routine clinical practice settings. Yet another propensity-matched analysis of a U.S. claims database found TT fields increased overall survival by 4.2 months compared to chemo alone. Based on the robust efficacy and safety data from randomized controlled trials and registries, TT fields have become an important standard of care treatment option for unresectable MPM as a first-line therapy in combination with chemotherapy. The NCCN guidelines now recommend TT fields as a Category 1 option. While still not curative, TT fields provide one of the largest survival benefits seen to date for MPM patients and represent an important milestone in the treatment of this devastating disease. Ongoing research continues to further optimize the use of TT fields alone or in combination with other therapies to potentially extend survival outcomes even more. TT fields or optical therapy have shown clinically meaningful and statistically significant improvements in overall survival of 2 to 4 months over chemotherapy alone in well-designed Phase 3 randomized trials and real-world studies involving hundreds of malignant pleural mesothelioma patients. TT fields are now an established standard of care first-line treatment option based on their favorable risk-benefit profile demonstrated through robust clinical evidence. They provide one of the most impactful therapies to date for this historically hard-to-treat disease.